Hi to you all. I am Dr. Anand Prabhu Sude. I am a founder of Mangal Prabhu Nursing Home at Juinagar, which is 35-bedded hospital. Now, important topic today we are going to discuss is how to identify malarial symptoms at home. When you come across a child who is sick or non-sick, if a sick child, then if you have a fever with chills or rigor, or you have say pain abdomen, you have respiratory symptoms, you have loose stools, distension of abdomen, you can have seizure, you have headache, severe vomiting, all these symptoms you come across, you should be able to identify it as malaria. The most significant and important thing in malarial identification is fever with chills and rigor. This is also known as hot stage or cold stage. Hot stage is you feel very hot, like you won't feel like keeping all the blankets you throw around, is in hot stage. And cold stage is that fever with chills. It's so cold that you would want to have more and more blankets on you, and you're literally jumping on the bed like a rigors, like you feel like you're getting seizure out of it all. These are the things which you should be able to identify at home and then rush to the hospital or any healthcare system where they can identify the malaria by doing blood test and then treat accordingly. Blood test, what you have to go is around like identification. There are lots of tests for this, but more significant is rapid antigen test. That is rapid malarial antigen test, which is very short and accurate, which would give you results within half an hour to 45 minutes, and it's gene specific. Like if you're suffering from P. vivax, it would be positive for P. vivax and negative for all three others. Or if you're suffering from complicated malaria, then it comes as a P. falciparum, then it's negative for vivax and other malarias. So these are the rapid tests along with gold standard like peripheral smear to identify, CBC to know whether the platelet count has gone down, RBC morphology can tell us whether how he is going through. All these tests collectively give you a good picture about malaria. Based on these tests, if you turn out to be vivax, then you would have to go on to the gold standard. If you are not, the most commonest drug is chloroquine. Then thereafter, if you find that it's a chloroquine resistant, then you can shift on to ACT regime, that is combination of artesunate and lumefantrine, which is given per oral, usually for 3 days regime. Usually 99% of the people respond to this. Only few people which go into a complicated malaria which manifests with kidney issue or say respiratory system or CNS, wherein you have convulsion, you have hypoglycemia, then you can go on to the other medications. Ideally, the major treatment is for 3 days. And then to prevent the relapse or reoccurrence, we usually give primaquine for 14 days. So that helps from preventing the relapse of malaria. After taking this medicine, after you finish the course and then you eliminate the relapse also, then less likely to suffer from malaria. If you're traveling anywhere else or you don't want to suffer from malaria, then you need to go on to a chloroquine prophylaxis program, which is like you take every Sunday one chloroquine tablet as 10 mg per kg per base, accordingly every Sunday for 8 Sundays, so that during the rainy season you would not suffer malaria. Or people who come to us from abroad, they come with this regime, so that in India it's a zoonotic parasitic disease. To prevent it, they usually start before the travel and they continue throughout with the stay in India. When they go back, after going, they stop the medications. Just to brief you, in short, we have now concluded how to identify malaria and treat malaria. If you have any comments or any difficulties, you can comment below after this video and we can get through.